For North Vancouver, Seymour.
Thank you, Madam Speaker, and thank you to the member from South Surrey. I really appreciate the compassion and care that she has for the folks that are dealing with things that are well beyond what the rest of us can deal with. So we need to work. It's clear we all need to work together to support folks that are dealing with mental health and dealing with mental health changes and dealing with mental health illness, some to the extent of self-harming and suicide. And the government has been working for many years now towards creating a solid and comprehensive mental health system that is open and available to the needs of those who seek it out and who are brought to it. Because on many occasions we have folks that they have mental health needs, but they're unable to get there themselves. And so they need folks on the ground that are able to help them to get to those places. And so now what we're looking towards is, rather than a patchwork of fragmented services that are here and there and not necessarily available in this area, but are available if you come from your community to here, we're trying very, very hard to get a full, comprehensive mental health state in place. And we're working on that, and there's been a lot of success as well. We have we now have services for 452 complex care clients in communities throughout British Columbia that include housing and tailored supports for those living with complex mental health challenges. We've got funding committed for more than 2,240 new full-time equivalent healthcare workers to support team-based care through various initiatives, with currently about 1,500 of those FTEs recruited. We're expanding the mobile integrated crisis response teams that pair police officers with healthcare professionals to respond to mental health calls. Teams provide on-site emotional and mental health assessments, crisis intervention, and referral to appropriate services in the community. Peer-assisted care teams made up of peers with lived experience and mental health professionals to support people in crisis by meeting them where they are, providing person-centered care and connecting them to follow-up supports. In 2022, the province committed $10 million for new and existing mobile community-led crisis teams, and the peer-assisted care teams were again piloted in North Vancouver. Well-being websites so that people can more easily navigate our healthcare system and connect with mental health resources and supports that they need. And we also have the PharmaCare's Plan G, which is for psychiatric medications, that patients meeting both clinical and financial criteria are fully covered for psychiatric medications.
Thank you, member.
Which is one of the best in Canada. Thank you very much.
Member.